Hi, everyone. Thanks so much for tuning in. My name is Shefali Haldar, and on behalf of my co-authors, I'm excited to share our study published at CSCW this year. I'll start by saying that the hospital is a very stressful and scary place for many people, now more than ever. There's a lot of uncertainty around the patient's care plan, a lot of confusing medical jargon, unfamiliar providers, high risk of experiencing medical errors. All of these challenges really build upon each other and create a very complex healthcare setting for patients to navigate. One way to help patients overcome these challenges is to offer them the support of their peers in this setting. We know from a big body of CSCW literature that there are a lot of benefits to patients engaging with their peers, such as increased self-efficacy, knowledge, and empowerment in their care. But a lot of technologies that are designed to facilitate this peer support are designed for chronic conditions or for use outside of a clinical setting. So we still have a lot of questions about how the support could be enabled in the hospital. So our research team was actually very interested in how to translate peer support technologies into the hospital setting. So we designed and built this patient advice system, or PAS for short, which is essentially a Reddit-inspired online health community for patients to connect with each other during their hospital stay, to share advice, upvote, and comment on this advice. And we had two main research questions about the patient advice system. First was, how do patients actually use the system to connect with peers during their hospital stay? And second, what are patient experiences, or what are the benefits and challenges of actually using a peer support technology in a clinical setting like the hospital? So in order to answer these questions, we followed this method's procedure. We first did a bedside interview with patients and started them on the onboarding process, got them set up with the system. We then had them use the patient advice system for their hospital stay, and once they returned home, we did a brief phone interview to reflect on their experience using the technology and interacting with their peers. And we repeated this process at two hospital sites, a children's hospital and an adult hospital. We recruited a total of 30 participants for this research study. Our study produced a lot of data and a lot of findings. We cover these in a lot of detail in our CSCW paper, but we talk about a number of different areas. For example, the overall usage patterns of different features of the patient advice system at each hospital site. We discuss how patient peers interacted with each other through the patient advice system. We share what types of advice were exchanged between patient peers. Here's a quote from a patient, for example, who's looking for social support in order to pass the time during his hospital stay. And we also discuss, again, the benefits and challenges of using a peer support technology in the hospital. So here's a quote from a patient about discussing the trade-off between managing illness versus engaging with peers. We also do have a related publication that specifically goes into how the patient advice system actually impacted the quality and safety of our patients' hospital stays too. But for today, I just want to focus on the key takeaways for the CSCW audience. The first is that our community of participants in the hospital shared these characteristics of having a shared experience of a physical place, but also high transience in terms of a lot of turnover between community members. And so in our paper, we discuss the implications of these characteristics for online communities, how to design for these kinds of characteristics, and how we consider these in understanding how participants engage with each other and interact with each other. We also discuss a number of design implications for future peer support technologies in the hospital, such as integrating local expertise and institution-specific information, aligning the peer engagement features and opportunities with how patients are feeling in terms of their illness management. And we also explore how to reduce the cognitive and physical burdens of patients and optimizing the connectedness that they need to feel with their peers in the hospital. Ultimately, the goal of these design implications is to create tools that allow patients to experience the benefits of peer support, overcome the challenges in their hospital care, and engage in their healthcare in a new way in this clinical setting. And with that, I will wrap up and happy to take any questions or talk about the study further. Thanks so much for listening.